Johnson & Johnson's Benylin Paediatrics syrup is facing a recall by the National Agency for Food and Drugs Administration and Control, NAFDAC, due to concerning findings of toxicity. NAFDAC announced on its website that laboratory tests revealed a heightened level of diethylene glycol in the syrup, prompting acute oral toxicity in lab animals. The agency clarified that a product recall is a manufacturer's request to return a specific batch of entire production of a product due to safety concerns, design flaws, or labeling errors, according to online health portal Science Direct. And NAFDAC urges caution among key players in the supply chain to prevent the circulation of compromised products. Those in possession of the affected Benylin Paediatric syrup are advised to cease its sale or use immediately and submit stock to the nearest NAFDAC office. Furthermore, individuals witnessing adverse reactions in children after consuming the product are encouraged to seek immediate medical attention from qualified healthcare professionals. Now, joining me on the news to discuss this is a consultant pediatrician, Dr. Ayodele Renner. Hello, doctor. Thank you so much for joining me.
Good evening. Thank you for having me on.
Good evening. All right. Now, the supposed syrup, the syrup's harmful content is diethylene glycol. Can you throw more light on it, please?
Yeah, so diethylene glycol is a hydrocarbon which is commonly used as a solvent for paints and dyes, and is sometimes found to be present in cigarettes, but is generally not suitable for human consumption and is known to have certain unsavory side effects.
All right, but then what are the potential health risks to children who may have consumed this contaminated syrup?
So it can be anything ranging from no symptoms at all, and where symptoms do appear, because the apparent symptoms does depend on the quantity that is ingested or the quantity that the product was contaminated with. But it can be anything as simple as vomiting, diarrhea, abdominal pain, and then a second stage of the symptoms can involve kidney damage. So they would have very little urine. They'd have a rise in certain waste or toxic substances in their blood because the kidneys aren't excreting those substances. And then on the far aspect of things, it can be coma, paralysis, and ultimately death.
All right. Now, Dr. Renner, can you tell us what immediate medical interventions should be sought of, if a child exhibits adverse reactions, or symptoms to Benylin Paediatric syrup?
I like to just let people know that, unfortunately, this isn't something that you want to administer any kind of first aid at home for, like palm oil or anything. But if a parent has used this product and their child or their ward is experiencing any symptoms, then the first port of call is to go to the hospital or the nearest healthcare facility for a qualified medical professional to examine and to run certain tests. They might be needed to be observed to see if the condition might progress or improve, and they'll take a decision based on that.
All right. Now, if this is not the first time that such products have actually been recalled, why does it keep happening? Why do we keep getting contaminated products into the market only for it to be recalled?
So it really does have to do with everything in the value chain, right from where it is manufactured, from the country in which it was imported. So there really does need to be international collaboration in terms of regulation of products and how the quality control measures are adhered to in terms of manufacturing. Then when it is being imported, I believe that this product most likely had a NAFDAC registration number, and it was cleared for sale in Nigeria. And so something does need to be said about the thoroughness of the process by which drugs are tested and how quickly these tests are done. It's most likely that there'll probably be some preliminary tests for the most toxic substances, something like this, I mean, I really would really like to hear from the regulatory body in terms of how quickly these tests are done and if these tests are done here in Nigeria. Because my guess is that if these tests are not done in Nigeria, then it might take some time before some of these results become available and then the recall happens. It really does have to do with the entire value chain, right, from manufacturing, importation, and registration and permission for the product to be sold here in Nigeria.
All right. Now, what about children who have already consumed the syrup but are not showing any symptoms yet? Is there a medical advice that you can actually recommend for them?
So the children who have consumed this syrup and don't have any symptoms the parents should be vigilant. They should observe, and of course, they should not administer any further doses of drug. And if they notice that their children are having any unusual symptoms, particularly nausea and vomiting, or for those who can speak, complaints about abdominal pain, or if they notice that there is any reduction in the amount of wee that the child is making, so if the child is having a reduced amount of urine, then that's a red flag that would suggest that you need to go to the hospital as soon as possible. For those who don't have any, yes, sorry, go on.
Go ahead. No, go ahead. You're saying something.
Yes, for those who don't have any symptoms, then please, yes, just be vigilant, just observe. If you notice any symptoms, then please go to the hospital.
All right. Now, you did say that, in most cases, the contamination actually comes from the supply chain. But in what ways can consumers themselves ensure the authenticity and also safety of the pharmaceutical products in light of this recall?
That's a very good question because at the end of the day, it's the end user that ends up suffering the consequences of these unfortunate events where products that are supposed to give health end up damaging one's health. And so what I say is that by the challenges that we face as a nation, that NAFDAC is a regulatory body, I think NAFDAC really has done a good job in making sure that a majority of the drugs that are in circulation are actually safe and fit for use by the general population. But I guess my advice would be, please don't use any drugs that do not have a NAFDAC number. That really will give you a baseline for safety as far as the drugs that you're using is concerned. And if you do notice that you use a drug and you have any unusual effects, please make sure that know this and that you report to your physician or whoever it was that prescribed it, preferably your physician, because you really should have drugs. Of course, they are over-the-counter medications, but for any drug prescribed by your physician, please report back to your physician about the side effects that you're experiencing, so that if it is not a side effect that is usual for that particular drug, pharmacovigilance can be reported and action can be taken on what that drug might have caused.
All right. Well, thank you so much, Dr. Renner, for joining us and enlightening us on this particular topic. We appreciate you for your time.
Thank you very much for having me.